Let's talk about anticoagulation medications and how to handle them around the time of surgery. There are several different types of anticoagulants, and every one of them is a little bit different, a little bit different mechanism of action, and they last longer or are reversible in some way. There are the direct thrombin factor 10 inhibitors, Eliquis, Xarelto, and Pradaxa. We have warfarin or Coumadin, and then we have the antiplatelet agents, specifically Plavix and aspirin. Generally speaking, the time to stop the anticoagulants before surgery is somewhere in the neighborhood of 5 to 7 days. Technically, some of these medications you could stop maybe only 2 or 3 days before, but we should be stopping the anticoagulants before surgery. Why? Because neurosurgery is high risk for bleeding. Not necessarily because the bleeding is that there's a lot of bleeding during surgery, but because if we have bleeding after surgery, it can cause neurologic injury. And then we do our surgery, and then after surgery, we can resume the anticoagulants. And I typically have the patients resume the anticoagulation about a week after surgery. Technically, we can be a little bit more narrow. Sometimes patients will bridge with a medication called Lovenox, which is a short-acting anticoagulant and can be given, and then surgery can be done like the next day. So its mechanism of action and effect is not very long. Patients that need a full dose anticoagulation for a mechanical heart valve, for example, something that's a really high risk for clotting, we will have them take Lovenox up until the day before surgery, stop the Xarelto, for example, maybe a week before, and then do the Lovenox until the day before. And then after surgery, once we consider there to be no bleeding and it's safe to resume anticoagulation, we'll again resume the Lovenox and bridge back to the full dose anticoagulation. This is a little bit of an individualized thing. So if you have any questions about your anticoagulant and what to do about it, please ask so that we can make sure that we can make surgery as safe as possible and get you from one point to the other across that surgical bridge, if you will. Thank you.